These are complex and challenging times we're in. Since March, things have just seemed like they're changing every day, that we don't know what to do from one day to the next. What's the right thing to do for ourselves, for those we care for? One thing we do know is that we should wear masks and we should maintain social distancing. But a lot of times we wonder, is it okay if I go take care of myself? Is it okay if I go to the hospital if I'm sick or if I have an injury? Is it okay if I go to my doctor? I'm Dr. Marcia Nelson. I'm the Chief Medical Officer at Enloe Medical Center, and we're going to talk about that today. It's important not to delay care because sometimes what seems to be just a small thing may really be a big thing. You may have heard the phrase time is muscle. That's used in reference to heart attacks. The longer you wait to get care when you have a heart attack, the worse the damage to your heart muscle will be. We also say that about brains, time is brain. We say that because the quicker a person gets in to have attention when they've had a stroke, the better their outcome will be. If you've had a broken bone, it's important also to make sure that you get attention quickly, because sometimes if you don't have an early attention, the functional result may not be as good as if you'd had attention early. Or sometimes something like an appendicitis can go from being simple and easily treated to something that bursts and has a lot of complications as a result of that. If you were to find a lump in the breast and say, well, it's just small, maybe I don't need to get it taken care of, and you don't seek care, then that could be a missed opportunity to take care of a breast cancer early when it's more easily treated. And also it's important to remember that things like routine childhood vaccinations need to be done timely, because we don't want to see resurgences of illnesses like measles because we've delayed getting our children the vaccinations that they need. What we're also finding is that 1 in 3 adults are delaying care that they otherwise would have sought out because they're concerned about the COVID-19 pandemic. Across the country, we've seen significant decreases in emergency department visits. That's not just in Chico, it's all over the country. And what that tells me is that people are choosing to not come to the hospital for a couple different reasons. People are choosing not to come and seek care because they're worried they might catch COVID-19. I can assure you that we are taking every precaution so that that doesn't happen, that your care is safe. And also people, though, are deferring coming to the emergency department because they don't want to burden the healthcare system by coming in and taking time for something that may not be a true emergency. Well, I can assure you that if it's important to you, it's important to us. Please come and let us help you. Enloe is still a safe place to get quality care for you and your family. We follow every federal, state, county guideline for delivering safe health care. You'll see us in masks. We'll offer you a mask if you don't have one. You'll see us washing our hands, and we'll offer you hand sanitizer. We want to take care of you safely, and we come to work every day so that we can do that. When the COVID pandemic started, we knew that we had to pay attention and look for fevers and for cough and shortness of breath. But over time, we've learned a lot more about it. We've learned that sometimes intestinal illnesses are associated with it. Sometimes changes in the way our fingers and toes look can be associated with it. And so it can be really confusing sitting at home saying, is this really mild COVID? Is it just a cold? Is it allergies? You don't have to figure that out by yourself. We're here to help you. We want it to be easy for you to get the health care that you need. The emergency department, like always, is open 24/7. Our clinics and our prompt care are available for you for your needs also. And something I'm really excited about is Enloe Anywhere. If you're at home and you're not sure whether you should come in and seek care, whether it's really a big deal or a little deal, call Enloe Anywhere. A nurse will be on the end of the line. You can talk about your condition with that nurse, and if necessary, a virtual visit can be arranged with a physician. With Enloe Anywhere, you can receive Enloe's high-quality care wherever you are. So I want you to remember, listen to your body, pay attention to what it's telling you, and if something isn't right, seek care. Enloe Medical Center was here for you before COVID-19, during COVID-19, and we'll be here for you after COVID-19 to give you that high-quality, person-centered care that you deserve.